Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Gargi Rawat. Let's get you the data first. In India, logged 37,154 fresh COVID cases and 724 deaths in the last 24 hours. The daily positivity rate is at 2.59%, less than 3% for 21 consecutive days. But the worry now is the R factor, which has started rising. It's at 0.95. If we take a look at vaccinations, that's the other worry with a rising R factor and low vaccination rates. 37.73 crore vaccine doses have been administered so far under the nationwide vaccination drive. But on Sunday, only over 12.3 lakh vaccines were administered as states complain of shortage of vaccines, while the centre claims there are adequate supplies with the states. India should be vaccinating over 86 lakh every day if we are to achieve at least 60% vaccination rates by the end of the year. Now, an initiative to promote best practices among people and doctors, the Choosing Wisely initiative started to promote conversations between patients and physicians about avoiding unnecessary medical interventions, has come out now with 10 evidence-based recommendations for the general public and for healthcare workers. A paper on the recommendations authored by an 18-member task force of public health experts has been published in Nature Medicine this month. Well, to talk more about this, we're joined by one of the authors, Dr. C.S. Pramesh, Director, Tata Memorial Hospital. Thank you so much for joining us on the program. And I'd like you to take us through the recommendations. First and foremost, the 5 recommendations that you had for the public.
Thank you, Gargi. Yes, as you mentioned, this was an initiative that we took to get all the stakeholders involved in COVID, whether it be public health experts, infectious disease specialists, clinicians, patients, the general population, all of them into the stakeholder group and come up with a set of evidence-based recommendations. So we had a long list of close to over 45 recommendations which came up amongst this group, but then for the sake of brevity, we narrowed it down to 10 most important recommendations, 5 for the general public and 5 for physicians. So I'll just briefly take you through the recommendations for the general public,
right,
which starts with very basic precautions, right? In spite of everything else that we do, probably the single most important or the 2 most important things you can do right now based on the evidence that we have is basic precautions. That is to avoid crowded places and be in well-ventilated places, especially while indoors. And the use of well-fitting masks, and I'll qualify that by saying wearing those masks appropriately. These, in spite of the hundreds of thousands of deaths that we've had in India and globally, are not things that are still adhered to by the vast majority of the population. Even now, when you go across in the city, you do see a large number of people either not wearing a mask, or even if they are wearing a mask, wearing it
on their chin. We see leaders often also wearing the masks on their chin, and that's something that, you know, we need to have better mask adherence and following of protocols. Very interesting was the 5 recommendations that you had for healthcare workers, because, you know, doctor, there's been such a controversy in this second wave, especially about the overuse of medicine, using steroids and using them at the wrong time. So if you could take us through those recommendations.
Right. So the second set of 5 recommendations mainly has recommendations for healthcare workers treating COVID. And the majority of them are to discourage the use of unproven treatments or tests. So I think the entire pandemic, both in the first wave and in the second wave, created a lot of panic, both amongst the general public, but also amongst physicians treating COVID, with the result that there were a plethora of unproven treatments that were being used, and not only are they of low benefit or no benefit, some of them could actually have some harm. So we're all aware of several of these drugs which were popular during the first wave. Thankfully has come down with growing evidence. Things like hydroxychloroquine and several other drugs which were azithromycin, antibiotics, favipiravir. So many of these which were not proven to be useful being rampantly prescribed, and we thought it is important to discourage this. The drugs that we know are useful to some extent, which include drugs like remdesivir and tocilizumab, also were frequently used in situations which were not indicated. So, for example, remdesivir is of actually no benefit in patients who don't require oxygen to maintain their saturation, nor is it useful in the other extreme of very severely ill patients. So we recommend against the use of remdesivir in these groups of patients. Similarly, tocilizumab is something that is useful only in the very severe patients. So we discourage the use of these in patients who are asymptomatic or mildly symptomatic. I think steroids have created a lot of controversy over the second and the third wave, some of which is either because of underuse and some because of overuse. Both of these are inappropriate.
Right. In fact, now with cases of mucormycosis that we have, there's also a fear of steroids, but they are an important medicine to fight COVID, but it has to be given at the correct time.
Absolutely. So steroids are one of the life-saving medications in the treatment of COVID. But again, it needs to be used prudently. It's again useful only in patients who require oxygen to maintain their saturation and in more severe cases as well. So it has virtually no role in patients who are asymptomatic, nor is it of any role if they have just symptoms like fever without actually a drop in their oxygen saturation. So we've also had this problem of mucor that has come in, and that's predominantly a reflection of the fact that steroids have been overused in some patients in whom it was not required. So while it is a life-saving drug, it is also important to realize that it is something that should be used very prudently.
Right, doctor, you also in your recommendations talk about CT scans and, various tests for markers, etc. And this is also which it had just become part and parcel of, a lot of doctors. Every time somebody reported a COVID infection, they would just recommend this ad hoc.
Absolutely right. So there are several such investigations, including the use of some of the inflammatory markers like ferritin and LDH and procalcitonin, and the routine use of CT scans. At one point, we were even using CT scans as a surrogate for the RT-PCR to diagnose COVID, which is completely inappropriate and, in my mind, a waste of resources. And it also lulls us into a false sense of security because patients with low CT scores can get severely sick and vice versa. So I don't think it's actually contributed much to COVID, and unfortunately, there has been a lot of overuse of these.
Right, and all these recommendations very important at this stage because, the talk is of whether there will be a third wave, whether we'll be able to prevent it, increasing vaccination levels, and we've also seen that the R factor has started to rise. So all this is a worry, and that's why such recommendations are very important.
Absolutely. I would add the recommendation to the general public to get vaccinated as a very important recommendation right now. We do have this paradox where in some locations there is a shortage of vaccines and people who want to get the vaccine are not able to access it. And on the other hand, where there is a surplus of vaccines and there is some level of hesitancy amongst the general public and they don't feel confident enough to use it. And there is also a group of individuals who keep thinking, let me wait for the Pfizer or the Moderna because we think it's better.
Right.
So the entire 18-member expert group's recommendation is that take the first vaccine that you get at the time that you're eligible rather than wait for that utopian situation where you're likely to get the best. And we really have no data to directly compare between these vaccines. So I think waiting for that ideal perfect vaccine is futile.
All right. Well, thank you so much, Dr. Pramesh, for joining us on the program.
Thank you very much.
Thank you. Well, now look at developments across the world, the situation in the United States where cases are increasing among the unvaccinated areas. Also, the Delta variant is leading to a surge in other parts of the world, with Australia reporting its first COVID death. South Africa and the UK also seeing a surge due to the Delta variant. To talk more about all this, we're now joined by Dr. Ashish Jha, Dean Brown University School of Public Health and a top health expert. Thank you so much for joining us again on the program. First, if you could tell us about this news that Pfizer has claimed that immunity starts reducing after a point with their vaccine, and they're talking about a booster dose. But so far, the CDC has said there's no need for that.
Yeah, absolutely. Yeah, so Pfizer came out last night here in the United States and said that after 6 months, people may need a third dose, a booster dose. I agree with the CDC. I have seen no evidence so far that people need a third dose. It's possible that maybe the very elderly or people with poor immune systems, they might benefit, but we haven't seen the data. And right now we're going just by, based on antibody levels, but what we really care about is infections and breakthrough infections and severe infections. And so based on the data right now, I think 2 shots is more than enough. But of course, if new data actually comes out that says we need a booster, then we can discuss it. But my hope right now is to focus on getting more people vaccinated, both in the US and around the world, and not worry so much about boosters.
And what is the situation currently in the United States? Because, there's some areas which are very poorly vaccinated, there's hesitancy, and then there are other areas where the vaccine numbers are very good. And now with the Delta variant, you're seeing a difference in terms of the regions and vaccinations levels and spikes in the disease.
Yeah, so America is really going through two very different sets of experiences. In Massachusetts, where I live, in Rhode Island, where I work, we have very high levels of vaccination. A vast majority of adults, 85–90% of adults, have gotten vaccinated. And therefore, we're seeing very few infections in these communities. But there are large parts of the country, Missouri, Arkansas, Wyoming, a whole bunch of other places where vaccination numbers are very low, largely because people have chosen not to get vaccinated. And what we're seeing there is very large spikes in cases, mostly driven by the Delta variant. The Delta variant, the original one that originally started in India, it is now widespread. It's probably 70–80% of all infections in the United States. And almost all of those infections are concentrated in these communities with low vaccination rates.
In fact, around the world, we're seeing the Delta variant leading to a surge in Australia, cases in Israel, in South Africa as well.
Yeah, Delta variant is going to very quickly become the dominant strain of this virus for the whole world. We're seeing it across the African continent. We did see a spike in cases in Israel. Again, most of these infections are happening among unvaccinated people, though vaccinated people are having some breakthrough infections, but mostly in unvaccinated. But it will clearly, I think, challenge the whole world because it is so much more contagious than prior versions.
Now, if we talk about the situation here in India, although the numbers are coming down and, we're seeing the end of the second wave, but they're still much higher than other parts of the world, and vaccine rates is a cause for worry. We're vaccinating, just a few lakh every day, around 4 million every day, and experts say we should be vaccinating around 8 million to 10 million if we want to vaccinate most of the adults by the end of the year.
Yeah, so India is in an interesting situation. I mean, on one hand, of course, thank goodness, so much better than where things were 6–8 weeks ago at the height of that second wave, and really across the country. I mean, there are places in India where still infection numbers are high. It looks like kind of things have flattened out at about 40,000 to 50,000 cases a day. That's still too high, and I was hoping to see numbers come down a bit further. But we will see, because, again, the Delta variant that is dominant is so contagious that as India opens up and relaxes those public health measures, you're going to see pressure for the infection numbers to rise. And ultimately, there are two parts of the strategy, right? I mean, there's keep some public health measures in place, not lockdowns, but other things, and then vaccinate as quickly as possible. And for a population the size of India, 4 million a day is great compared to many other countries, most other countries. But not good enough for the Indian population. So it's probably a combination of both having enough vaccine supply as well as the ability to administer it to all the people that really need it.
Now, even as vaccine rates is a worry for us, now another challenge that's arising is the R number. That started to rise again. It's around 0.95, and this is what we saw before the second wave in February. If you could tell us why this particular number is so important and why experts and epidemiologists watch it so closely.
Yeah. So the R naught is the number it's a reproduction number. And basically it's asking the question, what happens with each infected person? Do they spread it to one other person? Do they spread it to more than one other person? And of course, if you can imagine, the moment it becomes over one, then that means that the epidemic starts growing and more people will get infected and more people will get infected. And the thing about the R naught that people often don't understand is that in the beginning of that rise, once it gets above one, it looks very small. The increases look very small. But once it gets momentum going, it's really like a freight train, right? Like you start slow, and when it's moving very slow, you don't think it's a big deal. But once it starts moving very, very fast, we saw what happened in India in the second wave. So got to pay very close attention. It's always local, so it's not just what the R naught for the whole country is. What's happening in Odisha is different from what's happening in Maharashtra, which is different from Kerala. And we've got to look at it in each specific state and region. And right now, things are going to go up as restrictions lift. And we want to make sure that that number doesn't rise above 1, because if it starts rising above, if it rises above 1, that means we're going to start seeing an expanding epidemic.
Right, and it's at 0.95, so big a worry for us. Now, finally, I want to ask you about the new variant, Lambda variant, which everyone is talking about. How big a worry is this? Currently in India, there are no such cases.
Yeah, the Lambda variant, initially from Peru, has now dominated Peru. It's quite common across Latin America. I would say a few things. First is we're going to see more variants. I mean, this is one of the realities of this. So the Lambda and the Delta will not be the last ones. So far, the evidence suggests that the vaccines hold up very well against the Lambda variant. So I'm really not particularly worried. I mean, I think the Delta variant is much more of a challenge than Lambda. However, there's a lot we don't know yet about the Lambda variant. Those studies are being done. And if new data says that we have to be more worried, then we will be more worried. But right now, based on what I have seen, I don't think Lambda will end up becoming a major problem for India or for the US or UK.
All right. Thank you so much, Dr. Ashish Jha, for joining us on the program. And with that, time for us to slip into a short break. On the other side, we'll take a look at some of the frequently asked questions about COVID and about vaccines. And Dr. Pramesh will join us to answer those questions on the other side. Stay with us. Now, for our campaign, Vaccinate India, in partnership with Google, where we discuss questions that all of you frequently ask about COVID, about vaccines, questions that you often Google. And joining us to answer those questions for you, we have Dr. C.S. Pramesh, Director, Tata Memorial Hospital. Thank you so much, Doctor, for answering these questions. And now, with talk of Moderna vaccine also coming in, one of the questions that people often look up is how do mRNA vaccines work?
So, Gargi, these mRNA vaccines are a new type of vaccine. These are very, very modern. They're very recent in the battle against infectious diseases. And unlike other vaccines, the traditional way of creating vaccines is to create an immune response by putting in some kind of an inactivated virus into our bodies and thereby generate immunity. So there's this very small, extremely theoretical risk of actually developing the disease itself. But mRNA vaccines, on the other hand, they work differently. They teach our own body cells to make a protein or a part of a protein, like the spike protein in the COVID-19, which then triggers the immune response inside our own bodies. So this immune response then creates antibodies, and these are the antibodies which then protect us from getting infected if the SARS-CoV-2 virus enters our body. The key thing to remember here is that unlike natural infection, the benefit of getting these vaccines is that you gain protection without having to go through the serious consequences of falling ill with COVID-19, which has its own risks and complications.
Right, and these mRNA vaccines, the efficacy is much higher than the vaccines we currently have available. It's over 90%, which is why, many feel that these are the best vaccines. What would you say to that?
Right. So that's a nuanced answer to that. The protection rates that the mRNA vaccines offer, both the Pfizer and the Moderna vaccines, is upwards of 95% to develop COVID, and close to 99% chance of protection against dying of COVID, so which is remarkably good. On the other hand, we have the other vaccines, the ones like the AstraZeneca or the Covishield, which is available here, which offers a slightly lower level of protection. It's approximately 70%, but even these vaccines offer a very high level of protection against severe disease or mortality. So from that point of view, any vaccine is good, but your point is right that the Moderna vaccine offers and the Pfizer vaccines offer a very high level of protection, both against infection and against severe disease and death.
Right, but as all of you doctors say, you should take the vaccine that's available to you. That's the best vaccine. Another question that many people look up is, does the presence of antibodies mean that the person is COVID immune?
So again, to some extent, yes. The fact that someone has developed COVID or contracted COVID in the past and has developed antibodies to it does mean that there is some level of immunity that is offered to the person who is infected. But what we don't know is how long this immunity lasts, and more importantly, whether it is still effective against the variants that we are seeing. So someone who had the alpha variant last year might still be susceptible to the Delta variant this year. And that is the reason we feel that even if a person has got infected, has developed antibodies, it is still safer for them to take the vaccine, which then protects them against the other subsequent vaccines variants as well.
And what would you say to people, getting their antibodies checked every now and then? Now, people have fallen into this, they do it every couple of weeks, every couple of months, or every month rather. What would you say to that?
So that's completely non-evidence based. We have no data to support that that kind of a strategy at all. The only group of individuals where I would suggest testing for antibodies is the ones who are severely immunocompromised, patients who are on immunosuppressant drugs after maybe an organ transplant, or who are on immunosuppressants for an autoimmune disease. Their ability to develop antibodies against some of the vaccines is limited. So only in this very small subgroup of individuals would I recommend testing for antibodies, because if they've not mounted an antibody response to some of the conventional vaccines, there might be merit in giving them a shot of a different vaccine in the hope that that creates some antibodies which will protect them against COVID. But for the vast majority of the population, it has no benefit in testing for antibodies.
All right, so don't fall into that trap and raise your anxiety levels. Thank you so much, Dr. Pramesh, for speaking to us.
You're welcome. Thank you.